generally, being a healthcare provider is a challenging, is sort of like a challenging environment to be in. People are sick, you lose patients, you see a lot of suffering among people. And so inherently, nurses and midwives do require additional psychosocial support. And COVID in itself provides an additional challenge in the sense that there's fear of contagion. There's also fear of not just the nurse or the midwife contracting the disease, but also spreading it to their loved ones because they have to go home, you know, at the end of the day. There's also fear of loss of life. What happens to my children if I lose my life today because I'm providing care at the front line? So an opportunity exists to establish a framework and a support for psychosocial needs for nurses and midwives at the front line. And the way I look at it is COVID is pushing us to thinking that this is something we need to do now. And in my conversations with other stakeholders and in my conversations with potential donors, I've said we need to think about what happens post-COVID because we need an infrastructure that will survive post-COVID. We need an immediate response. Can nurses, can midwives access some sort of psychosocial support, whether it is through a mobile phone? Is it an app? Is it online? Because right now we have to do a lot of the things virtually because we can't really, you know, have people meet in a physical space. But then again, that means that should we later maintain this over time, it means that a nurse in Mandera can have an opportunity to interact with a counselor down in Mombasa because we've been able to establish the infrastructure that exists so that those in far and hard to reach areas are also not left out. So I'd look at this as an opportunity that is pushing us and highlighting the challenges that exist in terms of psychosocial and mental health well-being of a nurse and a midwife, but an opportunity that needs to go beyond post-COVID and make sure that's something that lasts longer.